All right, welcome back to another episode of the Macro Perspective, and we have our collaborative episode number 2 going on with our physician, Dr. Lloyd Camper today. Today we are going to be focusing on a few different things. I think we've probably touched on episodes, but bringing in a physician, first time. I don't think we've had a physician yet, Seamus. So this is a big one. We're going to say it's a milestone. We've had some other big people in the past, and to actually get a doctor on here. And this is not medical advice, I'm just kidding, type of thing. But Dr. Camper, so I'm going to have you just kind of give a little background of who you are, where you trained. I know that you're in a good deal of your practicing of medicine is in sports medicine specifically. So I feel like I will not do it justice. So I'll have you kind of give your elevator pitch of yourself.
Sounds good. Thank you, Marcos. Thank you, Seamus, for inviting me tonight. Thank you for also calling me a big person to come in on the podcast. So a little bit about me. I am one of the Cenegenics physicians, one of the newly recruits in the past year. Now, a little bit about myself. I am family medicine and sports medicine board certified. Um, the whole story is I'm originally from France, so if you hear an accent, that's kind of where it comes from. Came to the USA for college by way of California. Went to a junior college where I ran track, which was my sports, track and basketball, but I didn't do NCAA basketball. It was only track. And then ended up graduating from a biology major at the University of Southern California, USC, and continued on to complete my medical degree out of USC as well. The rest of my training, family medicine, has been done here in Miami, University of Miami, Jackson Memorial, and then completed my sports medicine fellowship back in California with Kaiser Permanente System. And at that point, had the opportunity to care for professional soccer players. So that was the sports that I got to practice on a little bit, which was amazing. And so out of it, was directly recruited by Cenegenics. And here I am now practicing health optimization and health performance, which is, it's a great field to be in nowadays, a growing field. I think a lot of awareness is starting to come towards it, especially after COVID, where everybody started to realize, hey, life can be very fragile and we need to take care of it. Anything can happen at any point in time. The previous thought, I feel like, used to be, it's okay, I'll grow old and might catch something later on. But now with COVID, they realize, no, I kind of need to be in good shape. I would have a higher chance of surviving if anything was to come up. So yeah, that's I would say my introduction.
Yeah, great job. It was truly an elevator pitch because it was like less than 90 seconds. And obviously, it's a good background. You're kind of giving that kind of feedback of, again, traveling. You said by way of France to Southern California to Miami, Miami to Southern California again, and then back to Miami where you're
I
now
stay in
at.
warm places. I stay in warm places. That's right.
Oh yeah, I
Got
would have.
to,
Yeah,
got to.
France is pretty warm, right?
At the northern part, not so much, but once you do that, once you do that trip, once you leave your own country, you kind of go for better things, and the rain and cold weather was definitely one thing I was trying to escape.
I,
Oh, okay, that makes sense.
yeah, that makes sense. I have a question, actually. I'm just curious. France to America, how do you feel the healthcare system
Oh,
kind of differentiates? What are the pros and cons of both? Or just kind of like the benefits, and all that kind of. I have no clue what France is like.
yeah,
I know.
we might need another series for that. No, but quickly. So healthcare, of course, it's a socialist country, so it's a single payer, and everything is under the government. So you get your social security, and they pretty much kind of take care of your healthcare. Your healthcare there is a right compared to America, where healthcare is you got to pay for it. One way or another, you got to go through health insurances. They used to be a fee for service, kind of cash pay, but that's not really how the system works in America anymore. And so, you know, I would say that the most similarity that America would have to France is Medicare. Once you get Medicare past 65, then you have an idea of kind of how the system runs in France, except that only the 65 and above have access to that kind of access. Pros and cons, of course, when healthcare is a right, and from the um, provider standpoint, as a doctor, you get, overwhelmed and overworked because, one, you don't get paid much, you get paid whatever the government pays you, and then you just got to see all the patients that you can pile on into your network. And so for that part, there's a problem of access because there's only so many providers, and then as the patients are trying to get access, then it becomes very difficult. I haven't had much exposure to their healthcare since I left, but my understanding now is that it's gotten even worse with COVID. Everybody's trying to get checked, and so yes, they're starting to develop telehealth, which was not really a thing before. But it sounds kind of very scarce. Like my family's still there, and when they try and see a doctor, it sounds like it's getting very, very difficult. Doctors are overbooked. Yeah, it's starting to be very difficult, and so I think in that way we're kind of lucky in America. Yes, we pay for it, but there's still a pretty good access, I guess, once you pay for it. Um, and I would say patient with Medicare usually kind of get also a pretty good access still.
I feel like that's debatable though. Like I heard, I mean, you have to choose the right part A, B, C, D, letter of alphabet with Medicare. I feel like while it is our attempt to kind of like quote socialize medicine to like elderly population, there's still drawbacks with it. Even with patients that we see here at Cenegenics that have Medicare as like their, insurance, and like their we'll call it like their hazard health insurance, right? Like in case like serious injury happens, whereas we're more preventative, right? I've been hearing some interesting stories as I have patients that phase into that 65 plus category, moving into Medicare, Medicaid. And I see a lot of international patients as well in the practice here in Vegas. And same thing, like, Canadian patients coming in from socialized medicine and also just saying the system sucks. You can't get in, you know what I mean? There's no one to actually, what's the word, give you healthcare, right? Like be a provider, provide you service. And I think that's where, after being here for 5.5 years with our organization, like I'm starting to see it more and more. Like before, I feel like health insurance has really changed since 2020 for sure. Actually, it really kind of dates back to like Obamacare getting signed into legislature, and then the premiums have like just surged for, I mean, myself and a young family. I mean, $700 out of pocket still to have to, meet this co-insurance deductible. $10,000 as my main deductible. You know what I mean? Like, I'm literally sitting here, Dr. Camper, thinking like, what if I just saved that $700, put it into like an ETF, and then pulled it out as I needed to pay for, out of pocket, like into like, and then I don't have to worry about in network, out of network providers, and I just go to people that I think will give me the service and actually want cash, because I
You,
feel
you're,
like,
you're yes, you're absolutely right. You're making a great point. Again, and that's like I mentioned, the difference between healthcare being a right and healthcare being a business.
mm-hmm,
Obamacare, the whole plan was to make it more accessible and more equitable for everybody to have access. Because before, let's say you have some kind of chronic illness, if the insurance says, "Now we don't want you," it doesn't matter how much you would pay for it, you just will not even have it, and you just literally have to pay out of pocket. And now, with the Obamacare, everybody is the whole concept was to have that pool, to that risk pool, to kind of pull from everybody, so you're kind of sharing all the expenses. But of course, those insurances, they're not here to optimize your health. Again, and we're here, from a
mm-hmm,
synergenic standpoint, they're not here to optimize your health. They're just here to make sure, one, you stay out of the hospital, and two, that you kind of stay in that same quote unquote network, stay in that same care. So you kind of, you're getting stuck in that box. And it's true that you could go and just pay out of pocket. But the thing is, the cost has rise so much. So
yeah, yeah,
if there was to be any kind of emergency care,
mm-hmm,
hospitalization care, you would set yourself back with a big bill at that point in time. And I
mm-hmm,
think that's really where the thing is really unfair, because on a day-to-day basis, if nothing happens, yes, sure, you can get by with no insurance. But the whole question is what if, and that's where the insurances are really banking on and getting their profit. And yeah, I do believe there's a lot of money wasted in those insurances that, could be pooled and used to get optimized care like we're providing. But in the meantime, you do want that safety net in the case of a what if.
Yeah, that's literally. I mean, if I didn't have two young kids, I would consider it. You know, but again, what if?
Yeah.
Literally, a little owie for my daughter's elbow is, you
Yeah.
know,
Yeah.
still. I mean, based on what they quoted the insurance, what I would have had to have quote unquote come out of pocket would have been 10 grand. Like it would have been they quote covered six of it, and I'm just like, for two X-rays on an elbow and for a resetting fee, and then taking up physical space was $10,000. That's
Yeah.
where okay, like going back to like why, and we'll bridge this over into like
Sure.
what we're doing here. The system is effed a little bit, right? And I said I wasn't going to say a bad word, so it's effed, right? In what world would someone walk into an establishment and be like, not ask what the price of something is? If healthcare is a business, right? There should be more transparency of like quote what the actual cost is for the services being rendered to any patient in my eyes, because that is a blatant like it's deceit, right? And we I feel like we need to find a way to create more transparency, which is why I love what we do. Hey, we're up front, like this is the cost, this is what we're including, this is what you're getting, this is what we're looking at, from our preventative healthcare lens. But if I would have walked into that ER and they told me it's going to be $10,000 with or without insurance, like that is the price, I probably I would have gone and look at a second opinion, even if it was in my network, right? Like I'm gonna go like, hey, I'm gonna call a couple other hospitals in the area and just double check that like theirs might be a little bit cheaper, right? Instead, you just go to somewhere in network, you think that you're gonna be taken care of, and yet, boom, you know what I mean? Like you don't go just buy a car. Like I mean, you could go buy a car on Carvana, but you probably want to drive it beforehand. At least they have a 30-day money back guarantee. You know what I mean?
Yeah. Again, you're making very great points, and I've actually written a whole thesis on that during my master's degree. Um, it gets very tricky. So there is no single price, like you said. You can go to different ER. There will be different prices, and
Mhm.
even at the same ER, the same hospital, there could be different pricing for the same exact service. Like you mentioned, the X-ray for the little girl, they might price you different if you come pay cash versus if you come with an insurance. Which kind of insurance? There's different contract negotiation on pricing, and that's where the whole system, you use the bad word, but I will say, is completely fragmented.
Mm.
um
It's
that's
effed. It's
really,
fragmented. There we go. That's what I meant. It was
it's
effed.
yeah.
That's
Yep,
that's good
exactly.
right there.
But okay, that's cool to know that you wrote a thesis on that, by the way. Like,
Yes,
because
I would. So, when you're young and you have all these ambitions, and you're coming from a social country and you're looking at this healthcare, you yourself going into healthcare as a provider, you kind of want the best for your patient. And with my master's, I was looking at from a public health standpoint, instead of
Mm.
taking care of patient one by one, what about we're looking, on a bigger scale? How can we help like the whole community or help the whole city? And being in California, California is very progressive, and there was a discussion to provide single payer. Who could be providing single payer in America? Would it be an institution? Would it be a state? Clearly, the whole country is not going to go single payer. A lot of states just don't want to deal with that, and also cannot afford it. But California is one of those states that could potentially, based on their GDP, they make more. The revenue in California is higher. I think it's one of the top revenues in the world. It compares to countries, full
yeah,
countries.
Silicon
So
Valley.
so
Yeah.
if one state would be able to do it, California would be the one. And we went to the Senate and everything, in the state capitol, discussed with some of the politicians, and there was that conversation of single payer. So I did my fair share of exposition and attempt to address the fragmented healthcare system, to realize that there are bigger forces that
Yeah.
allow it.
Yeah, no, that definitely makes sense, and going all the way to there. I mean, a little bit. I know you were in Kaiser Fontana. I know the Kaiser system is probably like a close system to that because like my mom has been in member services for like the last 20 plus years, and growing up, just hearing the conversations around healthcare, that language just was part of the day to day conversation with her of like how people are trying to take advantage of the system when Medicare and Obamacare kind of came along, and now all these new laws and stuff like that. So I talked to her a lot about these things and all that back end stuff, and it just sounds, from a perspective, I've always loved Kaiser, just because they do everything in house. Like they have everything there. They got the urgent care, the optometry, dermatology, all that stuff. How do you like? I know we're gonna go into Cenegenics in a moment, but like, how did you like your time at like Kaiser? How did you feel about that system when it compares to kind of all this?
I was looking up to Kaiser a lot, especially during that time where I was working on my thesis. It felt like the one single model that is really, you know, acting almost as a single payer in its own entity. It used to be very, the I would say privileged to get access to Kaiser. Not everybody could afford it, and then with Obamacare, then it went into also the this access and people being able to have Kaiser insurance. And then it felt like Kaiser got flooded in its own system. So now, once I started working with Kaiser, yes, sure, I loved your concept of being a one-stop shop. You come, Kaiser is your healthcare provider. It covers your own. It has its own insurance, and then all the services are right there. You have all the specialists, and I like the fact that everything goes through the primary care. So it's not like let me just go see a specialist. It needs to be reviewed and filtered through the primary care, which I used to call myself the point guard in the clinics, because before I send you out to all the different specialists, I'm the one distributing and reading kind of the game and reading your healthcare, and see what really needs to be addressed by a specialist, or what can we already do before, same thing, overcrowding the system. But in the meantime, you're overcrowding the primary care system there.
Mm.
And so, same thing, just like the single payer in France, they're starting to become an access problem, and some of those patients will not be able to see their primary care because schedule is already packed up for the next 6 months, 8 months at a time, and here you are having to use the urgent care yourself in your own healthcare system. And I found myself as an urgent care provider at times getting patients telling me, "Hey doc, like, are you taking new patients in your primary care office?" Of course, I was not, because of the position I was in, but just to see that was just showing me how from the outside it is a great system, but on the inside you still run into that problem of access.
Are we seeing a physician shortage in America?
Yes, for sure, it's been happening. And the other thing that we need to take into consideration is, becoming a physician is not getting any easier. Okay,
No, I know.
it's getting very expensive. The debt that physician uh, compiled by the time we're done with medical school is enormous. Cost of living is getting insane. So you have to take all of that into consideration once you want to decide what specialty or what field of medicine you want to go into. And that's where, a lot of those medical students pick specialties that have a higher income, or they're more specialized. So then, of course, I would say the lowest paid jobs, which are the primary care
Mm.
physicians, are starting to kind of have that shortage of medical student going into the field. So that is, another thing that's really
Well,
happening. So there are specialists, but when it comes to other fields, there are some shortages.
yeah, but I feel like for most primary care things that I go do, and this is probably maybe Nevada specific, you're getting an NP or a PA more often than you're getting the actual MD. You know what I'm saying? Like they're running a business that is,
Same
again,
thing. You're right.
same. It's like kind of like it like addressing the problem, and the people are like, well, I don't get to actually see the physician because like you just said, it's like these people have gone through a fair amount of school as well. They have the ability to actually prescribe at that point. That it's that they may not have been able to take that traditional physician route, because for myself, like I want to go back and become like a PA. I actually want to actually become a physician, if I'm being honest, but like I don't want to try to bury myself in debt and spend another, I'll be practicing by the time I'm 40 effectively, right? Like that's
Exactly.
insane. But like, the PA route makes a little more sense because it's, 3-ish years and I got to go back and do a few prereqs. And, but it's kind of the same thing that you're saying. It's like, that insurmountable amount of debt, like cost of living getting higher, you're coming out of school with like great earning potential, right? But also like, did you have another job before you didn't like became a physician? Probably
Yes,
not.
yes, I
Yeah.
did a few gigs during undergrad. I worked as a valet.
But like
I
a career though. No one else like
Oh
you
no,
don't.
no, 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 no.
No, it was
I
just like
went
odds and
straight.
end jobs.
I was a school guy, and on top of it, as an undergrad, I was already a student athlete, so doesn't give much time being an athlete. Plus, having to compete for the grades and getting accepted into medical schools. This is a full job. This is already a full job. Um,
Yeah.
but
Yeah.
yeah, no career,
I
no
would
career.
back I would back the student loan forgiveness for physicians, especially because knowing what I know now, it's like obviously we need physicians, and the amount of money that like you're potentially taking on as like a debt factor is
You know,
insane,
yes,
Yeah.
yes, agreed. Of course, I would love to get all my debt also forgiven.
You try to work
Um,
at a
but
nonprofit, that's what I've heard. Nonprofit for 10 years and then you'll get it all
yeah, so
wiped clean.
basically cutting down on your income for them to forgive it, cutting down for 10 years. Not sure, if you can increase your income and working for actual for profit, it's just pros and cons. I think, where and of course, like I said, I would like to have those loans forgiven, but you have to think from I like to think from the standpoints of every party involved. So when you think about the government, if there is one kind of people that are going to be able to pay that, it will be the doctors. If there's somebody that will be able to pay it and that will kind of always in the way, quote unquote, be hired and have a job, it will be the doctors. But at the same time, what I find unfair is the interest. If you could remove the interest, I think I would be fine, because it's like I'm already
Yeah.
borrowing money that I will be paying back, and you're trying to grow your return on investment on top of it, while we're losing. So it's that would be my main argument. It would be, let's, if you were to forgive something, at least forgive the interest, and then we'll just go on with the principles.
Yeah, there's this documentary from the Dave Ramsey group called like Borrowed Money or something like that, or Borrowed Time, and I watched it like a year or two ago on Amazon, and it was like this dentist got like a $900,000 like debt, but his interest was so much that every time he basically paid it was like the same. Like he was just paying into like a void that kept replenishing into the same amount every time. So it was like it never went down. He just
Well,
felt like
yeah.
that, you know?
Yeah,
Well,
no,
doesn't the
it's
rule of the rule of 72 applies with debt just like it does for investments, right? So like if it's a, what is it, 7 to 10% loan divided by whatever that is, and then you put it in there and that amount is doubling in the next 7 years, right? Like again, if you're not really attacking the principal, you're not really doing any damage, and it's a perpetual system here. Like
right.
we make a lot of analogies to finance in here, Dr. Camper. So like we get we finally get to actually talk about like again a potential problem. And again, like I as a student, I was like, how do I even know if I would want to do that? Like you obviously had like that feeling, like that felt like it was where your path was. Obviously, we're about the same age. I couldn't fathom half a million in debt because I didn't even know what it was to actually like quote own something or pay something to that extent. And then so you're going in kind of with blind faith, thinking that you're going to be able to, provide for your family and do all those things in the future. Granted, you don't even have one at that point because you're in the books, right?
Yeah, yeah.
Um,
I mean,
so
it
it's
is a very rewarding field. The care that we're providing, what is coming back to us outside of, like we just discussed, financial gain. It is still a very great field. Like, especially here now, we can transition to Cenegenics, a field
mhm.
where we're providing optimized health performance. The satisfaction that I get out of my patients is just it has no price tag really, to be honest. And that's why I chose that field again. It's not there are different fields of medicine. You could be working in a hospice and kind of deal with life and death every day. But I'm lucky enough to be in this field where when my patients come back, it's not, I'm not even in the traditional medicine or the urgent care setting where, okay, now you're not hurting anymore. You're okay to get by. Now my patients, they're actually coming back feeling like the best they've ever felt before. They're literally, just can't believe what, and what health status they were before coming to us, and the kind of medical management we're providing that is, I want to say, completely different from what we're providing in primary care setting or traditional medicine settings. Um, the training that we receive, all of us as physician, and obviously we all want the best for our patients. First, do no harm, and we want to make sure that they live long. But in the end, it turns, the bulk of our teaching during medical school and during our training is how to treat a disease. All right. So
Hmm.
we just wait for somebody to come to us with a disease and we treat it. Obviously, when they come with the disease, they're in a really bad state, regardless of what it is, and you're basically just kind of putting back to their point zero where they are not sick. But does that mean that they're healthy? Not particularly. They're just not sick. And potentially just waiting for the next sickness to come around. On the other side, what we're doing as Cenegenics is they're coming and they're not sick. They're at point zero, and we're just kind of taking them to point 10 or point 100. And for them, it's like, okay, now, I'm not even thinking about sickness. I'm just feeling great. I just love the way I feel. I'm energized. I, can fulfill my, daily activities and plus. So it's really that rewarding field, and so yeah, it makes you forget kind of like all the things you had to go through to get there. Not that I take it for granted at any point in time, but you know when I see sickness, it definitely reminds me that why we're in the medical field and what other physicians are dealing with.
Oh yeah. I
That's a
mean,
good.
you brought up the continuum, and I don't normally share graphics here, but I'm going to do it, or see if I can't blow this one up. Hold on. Open image in new tab. All right, cool. Because I think this is actually a really good point of talking like what we do and having like a visual for people, so people
Okay.
that are actually like watching.
Yeah, absolutely.
Um,
Always
this
excited to
this
be
one,
sharing what we're doing.
Yeah, I love
oh
it.
yeah. So let's go to this one here. Beautiful. Should be able to see this. All right, cool. So everybody's now kind of looking at the wellness, sickness, and fitness continuum,
Hmm.
and
From sickness to
this.
fitness. I love it.
I love
So,
that. That's awesome,
so,
man.
so this one is actually, I want to. This is from Barbells for Boobs, and I want to say CrossFit actually kind of, CrossFit as a fitness methodology, and Greg Glassman's main key components was really about like actually trying to reinvent like healthcare in a sense. No longer it was it sick care, but it's like healthcare, right? And optimizing performance, right? So this infographic, wherever it originated, I'm not sure. Obviously, we can cite it somehow, some way, some form. But like, to be well, right? A normalized blood pressure, body. This is for males. I'm going to assume 20% body fat is, sub that is going to be where you're seeing wellness, and then you're absent from any type of like major diagnoses, cancer, diabetes, high cholesterol, triglycerides, bone density is normal, have a normal sex drive, normal hormone production, and I mean the list goes on, right?
Right.
But with going to fitness, right? Like we're trying to increase protection from all those things, have better blood pressure than the norm, have a better than normal body fat percentage, which are all things that are very calculated, right? But like you just described, like you're getting people coming in when they're sick, right? You're seeing one or more of those conditions, the cancer, diabetes, and things like that. The body fat's through the roof, blood pressure doesn't look good, and then traditional medicine is like like you said, treat, do no harm, right? But and I think this is a good question here, like, well, how do we get people to be well, right? Like what does wellness look like? What are our core I mean, our core four, right? Or our five pillars, if you will. Like, what is it that like actually makes somebody live a life that has wellness, in your eyes?
Yeah, absolutely. So I think it's not a four core. I would call it a three core.
Okay.
And how do we go from sickness to fitness? So I think the first part, as we mentioned, is one is treating, and the second part is optimizing. So treating and optimizing are two different things.
Hmm.
And I like to give the analogy of the gas tank. I give that a lot to my patients. So you just like you have people that just drive around with their needle right outside of the empty gas tank, and they're just kind of hoping for it not to go in the empty, but at some point in time it will go into the empty, and that's the only time that they will go to the gas station and kind of fill up. And again, there's different kind of patients or people where they just want to get out of the empty tank and just put $10 and go to a quarter of it or maybe half of the tank. And that's kind of where the traditional medicine is at. It's like they have that range, and when you get out of the range, that's when you hit the empty sign or there's a red flag, and boom, you need treatment. Then you're sick, we need to treat. But you can be a quarter full or half full, and everything is fine. You're within what they would call their range. First of all, a range could be very wide. Okay, so you could be at the bottom of the range, not being on empty yet, but does that mean you're going to drive far? You're not going to drive far if you're just outside of the empty sign. So I think the optimization is making sure that needle is past half tank and hopefully full if possible. So that's really the optimization of health. And so I think the three cores that I like to promote and what our management and optimization is based out of in Miami are three things. One, it's make sure we're having the right physical activity. Okay, so physical activity is one of the pillar. Second pillar is going to be your nutrition. Okay, so you want to have the right structure, so physical activities, right muscle, right bone density, and then with that you want to make sure you have the right fuel, and with that include peptides, hormone treatments, and the last one is going to be your recovery, your sleep. Okay, so I think with those three pillars, we're really able to optimize and address the patient's lifestyle. And of course, there's all kind of subgroups. So when we're talking about fuel and nutrition, we're talking about supplementation. We're talking about making sure there's no, I would say, toxic behaviors with alcohol, drugs, smoking, things like that. So, within those three pillars, we can really optimize our patients' health and protect them from chronic diseases, protect them from all the things you were showing earlier, getting out of
Hmm.
high cholesterol situation, going, turning turning back around a pre-diabetic patients potentially, things like that.
Yeah, I like that a lot. I like that third one a lot. I think people sleep on that one, sleep and recoverability a little bit. Dr. Camp, I was hearing this the other day, and like I think a great, like a layman's analogy of like aging, right, is just your recoverability from life, because life just throws chaos at you. Like you do a workout, did you recover from that? Well, if you don't have recoverability because you're so stressed out from work, managing life and stress, and you don't necessarily may see these things as stress because it's obviously things that you do to not only get by, but thrive in life with your family, those you love, and all that. But people forget about that component and expect it to just kind of happen. Like people just, they might train, they might look at their nutrition a little bit, but they just expect to kind of fall into bed and sleep. And I really see in our practice here in Beverly Hills, and probably in yours too, is Miami. Is kind of like known for nightlife and stuff.
Yeah.
How much of an emphasis would you put on that third pillar? I know for myself that it's becoming something way up there as a big pillar compared to like people's fitness and nutrition. I sometimes put it before any of that stuff because sometimes, in my opinion, if we are adding these components on an unstable foundation, I probably it's going to be like a house of cards and falling apart at the end.
I agree. I completely agree. So again, we have to meet our patients where they're at. Okay. Some patients, they can sleep 10 hours and have no issue. So for that person, that third pillar is already pretty solid. Okay. So I don't need to put much emphasis on it. And that's just for the sleep part. Of course, the recovery is the sleep, but it's also there's the overtraining factor. So it's also you have those patients that are saying, "Doc, I'm hitting the gym 7 days a week, and but I'm not feeling good at all. I'm gaining weight, and I feel bloated, and how much do you sleep? Oh, I sleep well. I sleep 10 hours." But there's still that component of overtraining. You still have to give the muscle the recovery. You need to make sure you're adding the stretching to it. So I think yes, it's a very important pillar, and it's not just the sleep; it's also the as you mentioned, the recoverability physically. So that's definitely something that we touch on, and there are lifestyle doctors, longevity doctors that are making it their specialty, the sleep specialty, and they definitely do much more sleep analysis with sleep studies and other metrics, which we're not particularly doing at Cenegenics, but we definitely want to make sure if there is any kind of sleep disturbances involved. We want to make sure we trigger a right sleep, a deep sleep, including the REM sleep, rapid eye movement sleep, and there are different machines to measure those. We haven't touched on those too much, but I always want to make sure that my patients sleep well.
Yeah, I mean, we spend a third of our life with our eyes closed.
That is true.
So,
That is
I
true.
mean, like again, having a high quality bed and things that can help with recoverability and like there's, I mean, it all makes sense. Like one of the biggest purchases you probably should consider is like where you sleep. And I think we've, yeah, like again, those main three pillars, like you said, like how you would approach it from like physician to patient interaction is great. And then I'm going to share our screen again and actually look at our website here because we're going to shameless plug everything that I possibly can this episode because we hit on the components. Like, what are the 5 components of the Cenegenics program? Right, 3 of them again are managed in a sense, like from what you said. The other 2, like well, biofeedback, right? Like that's basically us doing our diagnostics testing, right? Um, and I think that that's also really important because we're gaining feedback from a hormonal standpoint, from again the physical, the physical perspective, right? Like of how their training is looking, how they're improving. DEXA scan, carotid artery scan, you name it, right? We have a bunch of things in there. And I think the other 2 kind of lumped together, like the nutraceuticals and metabolic and hormone optimization. But like you just, like if you were to even make it even more condensed, you're like your fuel and recovery, your peak
Yeah.
fitness training or your
Yeah.
activity, right? And then the other one. But I think it's also good to also
Yeah.
manage or
So
talk about
just to
those.
really, yes, to just really add a comment here on what we're providing at Synergenics, and what I enjoy a lot, and I think it's a significant advantage is that the medicine we're practicing, we have measurable markers. We're not just saying, oh,
Hmm.
we're making progress because clearly we're following clinical findings. So patients will also report improvement and um, different personal metrics, it being their energy, their libido, their body mass, things like this. But we can also really assess it with our scans, with our labs, with our fitness evaluations. So it's really we're able to continually assess. We have a solid baseline from our initial assessment, and then as we follow through, we see hopefully progress and for the majority of cases. And when we don't, then we can always kind of backtrack and see what has been done, what can we do differently until we achieve success.
Exactly, right? Like you said, it's all encompassing, from brain scans with something newer for us, like with the WAVI, the VO2
Hmm.
max tests, obviously the urinalysis, which is part of like the blood work, if you will. It's kind of all
Right.
taken all at once.
Yes.
Um, Resting metabolic rate, I mean, we get an estimation from just the DEXA scan alone. Also, we could do it on our VO2 machines.
Hmm.
We have other neurocognitive related things. And again, like, I mean, the list goes on and on. Like, and we're constantly looking at ways of enhancing and getting a better way of analyzing things I mean, it seems like, I mean, technology is just going crazy right now. It's like figuring out
Yeah.
which one is
Yeah.
actually like
No,
so applicable to people. So like it actually
exactly.
helps us create
And
changes, right?
exactly, and I love how Synergenics is really proactively staying on top of the technological advancements. I love it. We are staying on top of it. We still follow the data, and a lot of things are still preliminary, but when it's very obvious, like a body scan or a brain scan, I mean, it's right there. Even if there is no data on it, we still could start creating the data ourselves and pilot those different technologies, again, as long as it causes no harm, and
Mm.
we get a baseline for our own patient and able to evaluate, are we getting progress? As patients have different complaints, life happens, aging happens, we're able to compare. Hey, this is what your scan looked like 5 years ago, or this is, where we are now. And um, I think, we're definitely onto something. It is a progressing and growing field. It's been around for a little while now, but
Yeah.
like I said, there's more and more awareness. Patients are really trying to be healthy and healthier. They
Yep.
understand that the American system, the healthcare system, from a food standpoint, nutrition standpoint, it's not there. We're starting to see a lot
Yeah.
Netflix specials on fast food, and processed food and chemical food. So there's starting to be a lot more awareness on that end. And then COVID, I think, opened the eyes that it's not because you're just living and breathing every day that tomorrow you'll be fine.
Yeah.
Something can hit you, and if your
Yeah.
health is not optimized and your needle is right outside of the empty sign, you're gonna fall into that empty sign. And sometimes the treatment required, from our medical care, you know, can be a lot more painful, difficult, or more expensive than
Hmm.
you just optimizing your health on a daily.
That's just, oh man, that's a clip that Marcos clip that yeah, it's gonna be more expensive on the day. I had a conversation once, kind of like with my fiance's like parents and stuff like that. They're like, Seamus, like, why are you so stringent upon like the foods that you eat, and like you constantly take supplements, you take a lot of pills, and I was like, I mean, at some point, and I think Marcos said this in a different podcast. I mean, recently, it's like at some point you're going to pay for your health either now or later. And it's funny because I'm still going to take a lot of, you're probably going to take a lot of pills when you're older because you're so deficient or you need medications and certain things. Obviously, the pills that I'm taking now are supplementation, but because I live such an optimized lifestyle, I'm trying to put my numbers in those Cenegenics categories for labs.
To
I'm
fill up
using
your
these.
tank, trying to fill
Yeah,
up your tank. That's right.
I'm filling up the tank. I have to because I'm training so much. I'm going hard here at Cenegenics, and getting after it and making sure to get the right sleep. But there's just things that you need, and so it's like I said to them, I wasn't trying to be cheeky, but I was like, at some point, we all got to take the pills. You either pay for the drastic ones where you like need an intervention, or you just have the ones that's preventative and optimized. And I'd rather take this route, and it's like daily behaviors of just like you know
Yeah.
pills in the morning, pills at night, or something like that. And it's the quality of it as well. And we're learning a lot more studies on these supplements, efficaciousness of it, the dosing of it, and really putting the right things there with things like examine.com, or even just the research that we are privy to. But my question, I think, you've kind of touched on it, Dr. Camp, and I think this is really important. What do you see for this field over the next 5 to 10 years? As we saw, it's coming up, especially post lockdown, post COVID. It's like people are like, I want to take health in my own hands. I don't want to respond. I want to just be preventative. And I've seen that in my, not just like Cenegenics life, but just like people around me and my social circles and stuff like that. And then also the social media upheaval of it. I mean, there are bigger names now, and people are, I I don't know anyone not in my circle, even not in my circle, going into like a thing, a party or something like that, talking about wellness and longevity like it's the new fad, and it's like this thing. They're like, oh, did you read this book? Did you listen to this podcast? I feel like everyone's doing it nowadays. You know what I'm saying? What are your thoughts on that?
Yeah, no, just to kind of jump back on you will pay you will pay for your health now or later. And this is kind of, I from a traditional medicine standpoint, you're thinking do no harm. You don't want to be on too many medication as possible, and you're kind of thinking, you're kind of having a magical thinking in a way. And so you think that things are just, in the simple way, things are just gonna um, just happen by themselves. But now I realized that you do have to go out of your way to optimize your health. And yes, you can choose not to do it, but you will pay for it in the long run. So just to simplify things, and again, that's not from a medical standpoint, but I rather take my fish oil now and get a little bit of exercise than being stuck in 10 years starting blood pressure medication and having heart problems. That's different kind of problems that once you start going into that circle. So that's why it might be a lot of supplements that we provide our patients and nutraceutical, but again, you're better off taking your vitamins now and for the long run than start being completely stuck with pharmaceutical management of blood pressure, cholesterol, and whoever, if you develop dementia, all kind of management. So, and not to scare anybody, but also cancer and things like that. Not that you would, avoid a cancer just by taking your vitamins, but you're obviously in a realm of preventative medicine. So one, you would obviously get early screening, and you would also avoid um, toxic input with healthy food choices and things like that. So you're really preventive and preventing any any pathology that would potentially happen sooner than it would, or potentially not happen at all if you're able to really keep a healthy lifestyle. And then just to answer the question of where do I see the longevity field going in the next 5 to 10 years. So again, medicine, I could compare it to an art. Okay, it's an art. So just like you have all the artists, you have different kind of artists. You have the singers, you have the dancers, you have the actors. It's an entertainment. Medicine is not an entertainment. It's you're providing care, but everybody, you have different actors in it. Okay, you have the specialists, you have the primary care, and you need all of it to create the entertainment, to create the medical field. And with that being said, everybody's going to have their own view on how to sing a particular note, on how to act a particular part. Does that mean it's wrong? No, it's just there are different ways. Like Dr. Fadul from Cenegenics would say, there's different ways to reach the top of the mountain. It's not only one path. And so, with that being said, the more tailored our medicine is to the patient, you know, and everybody can do it in a different way, but the more you can tailor it to a patient, the least path to the top of the mountain will be. Because of course, if if you're very athletic, you can kind of take the steep path to the top of the mountain. But if you have some disability, you probably need somewhere where there are some kind of stairs or some assistance to get to it. So I think in the next 5 to 10 years, we've made a lot. In the last 5 to 10 years, we've made a lot of progress with DNA testing, and the data is starting to come more and more. So we're able to see how patients metabolize a particular medication or metabolize a particular vitamins, or how they respond to a particular kind of exercise, it being resistance or cardio. And so with that kind of information, in addition to all the scans and imaging that we have, plus blood biomarkers, we're really able to tailor the needs for that patients to reach the top of the mountain, and provide them with the right vitamins based on their deficiencies or their risks for deficiency, provide them with the right kind of exercise based on what they're more susceptible to respond to. And I think in that way, in the next 5 to 10 years, you know, um, a single patient can have its full DNA analyzed, and the full management that goes with it, with any specific risk factors. If you have a risk
Mhm.
factors of developing diabetes or high blood pressure, here, this is the medication that you will respond to the most if that was to happen. So I think that's where we're going, and that will be really to the advantage of the patient. And from our standpoint as physicians, we could still practice our art, and but still have pretty solid guidelines in how to do it while getting the most out of it. Because now, for blood pressure, I can use 10 different medication, right? But if I have my patients DNA response to a particular medication, I know which one I'm going to use. Or out of the 10, maybe I only have two that works for that patient. And that really tailors um, that care that right now would not be available in the traditional medicine world, because obviously insurances don't go through DNA testing. Um,
Hmm.
so that we really have an advantage here in that longevity field.
Yeah, the the craziness of it all, like you just said, was like, I know one of the ones that we're looking to include, I won't say the name of it, but like we got a little sneak peek of it, Seamus and I, as like things that are just going to be like our initial offer, because it's like you do it once and you're done. Provides a good landscape of even like, again, just beginning dietary interventions and foods that are, again, a little more reactive, and just, again, like already like day one coming in with us, that is going to provide, like, I saw the printout of it, I was like, this is amazing. Like it's so detailed and nuanced, but also not written at such a technical language that you wouldn't be able to understand it if you took it back up and were like, oh, what was that one thing that I like, what's the one thing I should be eating or that I wasn't eating, or the things that I don't respond well to. Like it broke it down in that sense. And like you just said, like back 10 years ago when I started coaching, I should say, I actually went to so before me, there was a performance health coach named Travis, and he was like really my mentor, right? He was working here and kind of coaching me up as we were doing nutrition coaching, and he was doing some of these tests back then, just blood biomarker tests and looking at food sensitivities and things like that. And he was a skeptic. He's like, hey, like I'm going to double check this. He sent the same blood sample, his sample, twice to the same lab and got two completely different results.
Hmm.
Nowadays, I doubt that would happen because of how much more fine tuned these things are. So he was like, I don't think it's there yet, buddy. He always called me buddy because he was like 10 years older than me. And RIP Travis, unfortunately. And
Wow.
so I was always like, okay, ever since he told me that story, I felt a little bit skeptical about it. But now the repeatability of these things is like the biggest thing, right? And also, too, I think that like you'd mentioned, like tailoring things using these sciences and the potential of, again, how do you know which one of 10 to pick? You're like, you can go based off of anecdote, which a lot of physicians will do. They're like, I've had great effects with this based on my patient base, right?
Data,
um,
yeah, and it goes on
yeah,
data, and of course we have to follow data. Scientific
yeah,
data is always great. The question is the generalized generalizes. I'm struggling with that word, but how can you generalize those results even if you have 50,000 patients in your research?
mm-hmm,
Um, then you have to go back. Okay, is it from a specific ethnicity background? Is it, there's a lot of things. And just to give just
mm,
a random example, when we do our child care, okay, when you bring your baby to your pediatrician as they're growing and you're looking at the growth and you're like, oh, my baby is in the 90th percentile of growth. My baby is tall or my baby is heavy. Um, the data to create that growth chart is based on Caucasian babies. So again, is it generalizable to, African American babies, Native babies, Asian babies? Um, Not really. So then it's like, should we have a different curve? Um, and so that's,
Mr. Camper, this is the conversation Marcos and I have been having. And I've been having to. I can't find his data. Like I've been talking to one of our other physicians who is like an informatics and data like masters, and it's like it's hard to find certain data sets. It's hard to find certain things. Like even one of the gold standards, for example, is like the DEXA scan. Like we're trying to figure out these things as people come along. So yeah, you're right. Like it's like, are they scanning it against a Caucasian young adult who's healthy, or like in this person's ethnicity and if in this person's age group? So yeah, it's interesting, right? The data is always interesting in what percentile you are, and again, putting like what is the
what is
individualization
the
of the process?
comparison? Yeah, it's what's the control? What's the comparison? And I think by having the DNA testing, you become your own control. You know what your gene
Mm.
pool is like. You know what your response to a particular medication, and then eventually we're talking maybe 50 years down the road, there might be a genetic database or genetic research where you're really looking, okay, based on, and New Amsterdam is one of those DNA testing companies that really keep that database,
Hmm.
and keep updating it as the data comes in, where they analyze a particular gene, regardless of your ethnicity or things like that. But they analyze a particular gene, and from that gene, they're able to know, okay, those are the particular consequences or reactions or metabolism that will happen in that particular patient.
Wow.
So, and
That's
as the
crazy.
database grows, might not be 50 years the way that companies like New Amsterdam's are really collecting data heavily. But as the more data we get, the more patients getting their DNA testing, the more we're able to collect and get actual, very tailored, very specific
Yeah.
information that allows us to act on. Again, there's also the controversies on, I don't want to give my DNA to
Oh yeah, I
that,
know,
but
right? They know too much.
yes, we're not gonna go into those details. You're always into those conversation until it's actually time for you to receive care. Just like patients that were like, "I'm never gonna receive COVID vaccine," and then next thing you know, they end up in the ICU, and now they want. I'm true story. When I was in the ICU during COVID, the family is saying, "Can we give my dad a COVID vaccine?" I'm like, "We're past that now. That the patient is
Mm.
ICU." And then you could tell that, I think based on history, those were anti, you know, and there's, obviously there were reasons. There was a new vaccines. There was a lot of fear, a lot of things going on, a lot of unknowns. But it's just until you're faced with the actual illness, you're starting
Yep.
to rethink and see things differently. And, knowing that we could potentially have everybody's DNA, or having really a good breakdown of what every single gene does, um, could help save lives, of course, and
Yeah.
provide with much more tailored and specific approach to management.
Wow.
Yeah. Yeah. I mean, the, that'll always be controversial, like our body, our choice, right? Like I feel
Right.
like whether it is from a woman's rights perspective or from just us being men, right? Like at the end of the day, you're allowed to have your own beliefs and things, but
Of
again, it
course.
always feels like you want to make a decision when it's too late, especially when death's staring at you in the face. But
Yeah.
I mean, I asked this question jokingly to Seamus the other day, and I'm like, you know, how are we defining longevity, this practice of longevity, if no one's ever lived forever, right? Whereas longevity also includes like health span versus just lifespan, like quality of life during that is really what we're selling at this point, right? Hey,
Exactly.
you can live to 100, but like not only you live into 100, but like you feel as if you were in your 60s the whole time, the best years of your life, which again makes more sense, like versus like living forever.
Yeah.
um, but at the same token too, like a lot of interventions are right now still maybe not around long enough to truly know, right? Like what are the adverse long-term reactions of using a GLP-1 agonist, for example? um, you know and again, here it's like you're going to rely maybe a little bit on anecdote, right? Based on like this person had like, more often than not, I'm seeing that semaglutide is having more adverse reactions than trizepatide, and then the new ones that come out like rututride or whatever however it's pronounced. And
There's
as they start
appetite.
learning, yeah, yeah, right. Like whatever the peptide version is. But it's all super fascinating too, because again, this is also where, like you mentioned, like the art of practicing, right? Like this is a practice. You're practicing medicine because you're constantly learning. And our conversation with our guest yesterday was talking about like when you stop learning, like you kind of go to die in a sense. Like he's like, when you stop learning, it's where the depression and all the other health states start to sink in. So like it's really cool from a physician standpoint. Like medicine's really in the place where the journals used to take, I don't know, how many years did it take for them to update and like give a medical journal? I know this predates you, but I heard it was like every 5 years maybe. Now it's every like 6 to 9 months or even faster with large language models. So getting your hands on so much information so fast that, yeah, again, that's why people have to specialize. Like I am, like you said.
Yeah, I'm just gonna know about this little part here that's being updated
Yeah.
every 12 months.
Yeah.
Absolutely, it is a very, again, it's rewarding at the same time, and just like we're talking about physical fitness, which keeps you physically, still able to do your daily activities, shower, stand, walk, run. I think the constant learning in medicine really keeps your cognitive
Yeah.
functions. That's our own workout. Doing
Oh
readings
yeah.
and constantly learning. That this is the brain workout right there by
Yeah.
Yeah.
by definition.
Well,
Plasticity.
yeah, plasticity, that neuroplasticity, and we do those too as well. But Dr. Camper, I want to be respectful of the time. We're hitting literally an hour here, and we'll
Okay,
do a hard stop. Just I know you've had a great day and everything. We could probably do a part two later because I think
sure.
this is one of the best conversations.
My
I'm
pleasure.
first physician we've had, so it's like
Yeah.
really, really, really epic. But let's just finish off with like what excites you about the Miami location and where can people find you? We'll just kind of end it off there.
What excites me, it's everything. Just the location is itself. It's Miami, so it's been the hub of physical fitness and attractiveness, and now we understand that there's also a health component that goes along with that. And so, as much as there's been Dr. Miami for a long time, really in the field of cosmetics, not particularly health. I think now people are starting to realize we need to discuss health, and I could see Cenegenics really kind of take a big chunk of that Miami market when it comes to longevity. We have been in practice for a long time as a company, and now opening this new practice in the heart of Miami. We're in Coral Gables, Miami. Um, I think um, we will have great outcomes there when it comes to our patient population, because I don't need to use cosmetic surgeries or interventions to make my patients look good. Just with those three pillars we discussed earlier, physical activities, nutrition, and good recovery, we see great results.
Sure.
Love it.
Yeah. And yeah, we're. I guess I'm a little sad that I won't be able to go to Miami again to visit you over there now that everything's getting really up and running. But the office truly, I mean, even Seamus, your new office in Beverly Hills, all the facilities getting refreshed and being
Yeah.
really brought into again having this modern look and feel. Like a lot of the times, people are like, "This is a doctor's office," and you're like, "Not your traditional doctor's office." Like,
Exactly.
like
Exactly.
this feels modern. Like again, it's not about the sick care, it's about the health care. It's about health span. It's about this idea of, oh, we'll use the term that Rudy used back in the day, Seamus, we're squaring the curve, right? You're living high quality up until
The moment.
whatever that big event, that moment
Right.
might happen.
Yeah.
It's not
Yeah.
this gradual decline.
Yep. Yep.
And we can really speak to this. And I know, granted, there's people that have been here longer than myself, like my physician that I work for here in Vegas, like the other physician that's been here that does our, education research, and all the people. But like the thing that I've noticed is like I get to look at people's DEXA scans once a year and look back at people that've been here for 20 years, and I legit get to see like that it is squared. It is like they're not seeing this decline. They are living this optimized lifestyle, and it's really
Yeah.
cool. So as more people get to come into the Miami flagship, into the Beverly Hills flagship, Seamus, like, I don't know, it excites me. I almost literally like told my dad yesterday, hey, like you probably should go see Dr. Matari because a lot of the things you're dealing with right now, you're not getting cared for. And also my mom. I'm like, you guys can afford to do some things like this, and you probably should do it because same thing that you just described, Dr. Camper. I was like, it's 6 months out before I can get into doing this thing for dealing with, a bladder issue. I'm like, that sucks. So you're gonna just like, it's gonna hurt to pee for 6 months, like, you know what I
Yeah.
mean? I'm like, I feel
Yeah.
terrible, and it's like you just said, it's the strain system. It's fragmented. It sucks, and it's like I really feel like South Park knocked it out of the park with their
Obesity
American president.
episode. Yeah.
Like you got to play this game, and we're not here to play the game. We're here to make people again come in,
No,
be invited
absolutely.
with open arms.
Yeah,
Yeah.
absolutely. It's a more it's a concierge medicine approach, really, where we're really providing that one-on-one care for our patients. My patients, instead of being in my office for 15 minutes and I have to just kind of go through their whole life in 15 minutes and get them out, and like you said, probably just fixing one problem at a time, it being the bladder or anything like that, and having to wait another 3 months to see me again. Here, really, I spend hours with my patients, and they have a more direct contact with me, it being my number, my email, and the team approach with the health coach, obviously, and the patient coordinator. So I think the support, the care that is provided to our patient is completely different. You don't feel anxious of not being able to access your team.
Yep.
Here,
Mhm.
that is not a thing in our approach.
Love that. Love that.
Right. Perfect.
Mic drop. Well, we'll end it there. Well, guys, I mean, honestly, one of my favorite episodes. I feel like I've, Dr. Camper, thank you so much for blessing us with your time. I know oh man,
It
it's
was a
going to be
pleasure.
epic, right? Guys, for the audience of my macro perspective peeps, we'll have this up and make sure to just comment. And, this guest series, we're really trying to rein it in and get some of these amazing speakers, amazing thought leaders in Cenegenics longevity space. So you guys are going to get this over the next few months. And for those that see it, please like, comment, and share. Definitely share with someone that you feel can take this, maybe a parent, maybe a family friend, or someone that you just care about that could definitely afford and make it happen. And they're seeing the tidings of the healthcare system. They could probably work with us here. But other than that, guys, macro perspective peeps, we are out.